Good evening and welcome to today's edition of In the Interim. I'm Bruce Mueller. I serve as the Interim Dean of the College of Pharmacy at the University of Michigan. I'm glad to see that we've got a lot of friends, alumni, students in the audience. And you're all here to see Bruce Chaffee, who's our guest today. Bruce is clinical professor at the University of Michigan College of Pharmacy, but also Director of Pharmacy Analytics, Quality, Regulatory, and Safety. And I didn't just invite him here because his name is Bruce, although that is a good reason because we know the cool people are all named Bruce. So welcome to the program and thanks for coming.
Yeah, thanks, Bruce. Really pleased to be here.
I have to ask first, that's a heck of a background you've got. It looks like you spent a little time putting that together. What are we looking at?
Yeah, well, when you do a lot of work with informatics and analytics, you get to use data quite a bit. And so back over here is actually my welcome letter to the University of Michigan. And it is from the College of Pharmacy because I was applying to the pre-pharmacy program, and Valina Perry, who many people at the college still remember fondly, was the one that probably got me into pharmacy school. So it's the meme of how it started, as you can see at the top. And the second one is how is it going, and that's what I'm doing now. I'm director of pharmacy analytics, which is the graph, quality, regulatory, which is the check mark, and then safety. And then how it will end, well, at some point in time I'll be retiring, and so I have a lake view of our cabin. I have a book I started, and I am going to learn how to play guitar much better than I know how to play it right now.
Outstanding. Where's the lake?
It's Chippewa Lake. It's in Mecosta County, kind of halfway up the state, over a little bit more on the west side.
All right. And the book, is it suitable for children, or is this a pharmacy potboiler, a whodunit? What are we working on here?
I'm gonna wait on the pharmacy potboiler. This is a young adult series science fiction book.
Oh, how cool! How cool! I do think there's a sitcom in a college of pharmacy, or even in hospital pharmacy, with all the characters that we've got. Perhaps that'll be my retirement thing, is to go for that. I really think there's possibilities there. Well, there's so many things I want to talk to you about, but I really want to make sure that our audience also can be involved in the program. So on your screens, everybody, you've got a Q&A button that you can put forth a question if you'd like me to ask it, or you can put it into the chat and we can sort of see it together. Or if you'd like to unmute yourself, I'm happy to have you join in to our program tonight to participate and ask Dr. Chaffee whatever questions that you've got. So I really want to make sure that if you've got questions, that you get them asked and answered. But Bruce, to get us started off here, we were talking off air. You've held just about every job. I don't know if everybody knows you were a faculty member in the College of Pharmacy at one point. That was job one. But you've done so many things over the years. What drove you to pharmacy analytics, quality, regulatory, and safety, which sounds like it was a bunch of jobs you've had and they put them all into a position for you?
Yeah, that's probably a really apt description of what happened. Well, every time I turned around, I ended up being asked to take higher and higher level leadership positions. And every time I get started on a particular pathway in my career, I'd end up moving into a management position. And so, the analytics world in pharmacy is really a self-taught profession. We don't spend a lot of time at the College of Pharmacy teaching about informatics and pharmacy analytics. And so it was a passion of mine to try and develop that area. It really wasn't even part of my title when I took the position of director. It was quality, regulatory, and safety, and I made Stan Kent put it in there. But I started out in my career doing drug use evaluation, medication use evaluations, which are really important to the quality process in healthcare. And so that was always my background.
And well, I'm assuming analytics was not in your list because analytics wasn't even a term that many years ago, to be honest with you. So give us, we have this overall kind of view. What's analytics, but what's pharmacy analytics? What am I going to do with it?
So pharmacy analytics is really taking data and information and knowledge and putting it to use in practice. Trying to take this massive amount of information and distill it into something that's actionable and usable to help patient care. If you look at how we've evolved in healthcare, we started off with paper orders when I started practicing. And, there's no way to really do a lot of good analytics on that. I remember doing my Pharm.D investigations research project at U of M, and I had charts stacked up, taller than me to try and do my assessments. Well, we implemented electronic health records at U of M back in the mid 2000s, and that really opened up the door to us to have access to all kinds of information we never had access to before. And so we would create, these small data sets and small databases that we could pull into data visualization tools. Most people have started with using Excel and creating graphs and using pivot tables, but there's now even better software out there like Tableau and QlikView and things like that that allow you to present information that can be accessed by anybody in the institution at any time. And you can use it for filtering data down to really important aspects of care. So you could look at, how many patients that are on aminoglycosides have renal toxicity, and then you could narrow it down even further using filters to specific services, specific patient types, things like that. And so analytics is really getting tools that you can use from a practice level as a clinical pharmacist to be able to make good decisions about your patients.
What I think is really interesting is how many times you use the word clinical and how many times you use the word patients and care. And, I think a lot of people think about informatics as you're only looking at some screens, some digital data. But in fact, we have a lot of students on the call here. How important is having the clinical skills in the first place?
Oh, it's absolutely critical. The foundation that you get especially at like colleges of pharmacy as good as the University of Michigan is very, very important, because you can't make good decisions about patient care unless you understand the implications. And we teach people about the drugs, the pharmacology, the therapeutics, et cetera. And you can get a whole bunch of data, but if you have all that data, you can't make a good decision. Would I rather have somebody in analytics that was a pharmacist that was taught analytics, or have somebody that's not a pharmacist that we try and teach clinical skills to? And by far, I'd rather have a pharmacist already in place, because they already have that background and foundation for how patients are to be treated and what the drugs will do, in the body.
Well, that actually, the questions are already rolling in for you. And one of them was, you've kind of starting to lead into it here, and that is for the students who are on the call, if they want to get into informatics, what do they need to know? I mean, should they learn computer programming? Is this the skill you're looking for? I mean, you're the guy. Did you start the informatics residency at the health system? I know you've certainly been involved with it. What are you looking for?
So Scott McCready actually started the program. It's one of the first ones in the country. Chris Zimmerman took over, and now Carl Renius, who works for me as an analytics pharmacist, is the residency program director for that program. We try and start people out actually at the College of Pharmacy by teaching a little bit in P616. I'm doing that right now. I actually taught last week on informatics, and this upcoming week will be on analytics, just as a foundation to all the different systems that are out there and all the tools that are available for people to do. It just touches on it. And then in 706, we actually teach them a little bit more about pivot tables and trying to apply it by doing an MUE project that we provide data to the students, and they can use it. And that's just to get them oriented to it. If you want to go on and do something more, there's really two different pathways you can go down. One is more the practical pathway, which is doing a residency and continuing to develop your foundational skills, and then do a PGY2 in informatics. And there's a number of places around the country that are excellent at that.
Well, what's the number?
Including several.
Bruce said there's a number, but is there 5 of them, or is there 40 of them? I mean, is it very big?
There's about 15 or so out there right now. And, we have one of our former graduates, Neil Adilo, who's out at Oregon Health, has one that he runs out there. So that's one way of doing it from a practical perspective. You can also get additional training and education. Some of it you can do through electives at the College of Pharmacy. Alan Flynn and I have worked together to develop a list of potential courses you could take as electives to learn more about it. But you can also go on and get a master's in health informatics. Carl Renius, who works for me, is doing that right now through the School of Information. And so formal training is a really good way to get some of those foundational skills in informatics and then analytics.
Well, one of the things as a clinician, I struggle with just keeping up with the medical literature because things are changing all the time, new drugs all the time. But then on top of that, there's new analytic stuff. You're talking about, oh, there's Tableau, there's this. How do you keep up with all this?
Well, I don't keep up clinically as well
Well,
as
but even with the
I
analytic
would like
stuff.
to. Yeah, well, it's really challenging. You know, my job is at more of a director level, so I don't really get in the weeds as much as I'd like to, and as much as I have in the past. But really, being an analytics pharmacist is probably the best way to embed yourself into that. And then it's just immersing yourself into the projects and looking for solutions. Typically, that involves also interacting with people that are in the IT departments. They can provide a lot of balance and skills for that. So just like if I have a question about oncology or antimicrobial therapy or cardiology, I know which clinical specialist or pharmacist I can go to learn about that. There are people in the informatics world that you can go to that understands the databases, understand Tableau, and understand SQL programming, things like that.
But what drives the question? So you've been an administrator, you've got this analytics piece, but who decides that? Is it an administrator who says we got to really cut the costs, or what are our outcomes in this particular oncology? Like, or does the clinician come to you and say, I think there might be a thing here? What's the process go? I know it's sort of CQI, but I'm trying to figure out how it starts in the first place.
Yeah, excellent question. Actually, it's both. You know, when you work at a health system as complicated as Michigan Medicine, there are surprises that happen. We went through, for example, you know, like everybody else has, COVID last spring. And when that came upon us, we dropped everything in the analytics world because we needed to determine and figure out exactly what drugs were being used in those patients, because it went from a situation where we had a good supply of drugs to scrambling to try and find drugs that we could use. And we used our analytics extensively during that time period. So it could be an emergency situation like that, or it could be something that's a little bit more planned. So on an ongoing basis, we track our drug expenses and we look and see which ones are most expensive in certain areas. We provide those reports to our clinical specialists. They review the dashboards. They can filter it whichever way they want to try and get it more detailed. And they come up with many ideas themselves to say, hey, I think we could probably save some money if we change the way we use albumin. And then you can get a group of clinicians together to talk about criteria for use of albumin and determine a way that you might be able to reduce our utilization and save money. So it comes from both pathways. It's both you know, homegrown from the clinicians themselves, and sometimes we get pressure from leadership, and sometimes it's just an acute situation where you just have to respond.
So in those cases, what are your data sources? You have a lot of places. You talked about money. There's patient charts, or there's ordering. There's probably pharmacy records. Like, where are all the places that you're looking to get this, that you're analyzing with your analytics?
Right. So, you know, one of the rules that any student that's had me in class will hear from me is you need to know your database. And so the first thing is to figure out what your data source is and what your database is, and make sure you understand those data. So we use the electronic health record first and foremost for the bulk of the data that we have. But it is vast and immense in terms of the amount of data that's in there. So we abstract the medication use pieces of it to our own little subset or a data mart called Pharmacy Data Warehouse. In addition to that, though, you need to combine data from other sources at times. And so we have the Pyxis system that's in place, and we need to pull data from that system. It's separate. It's not part of the electronic medical record. And so that can be combined then with data that we get from the electronic health record. Sometimes we use spreadsheets that people are maintaining manually, and we pull that into our data sources. And so there's a lot of different ways that you can pull the data, but by and large, when you're talking about pharmacy, you've got the pharmacy oriented applications such as the electronic health record, especially the pharmacy subcomponent of it, and Pyxis as your main devices.
You use the word immense, and you know, University of Michigan Health System is immense. There's tons of data, and I don't know how many patients we have. But I want to make sure we hit sort of all levels of this career area for the students. Can you talk about what happens at sort of the next level of data? There's national databases. There's, what kinds of, you're not going to do an MU. Well, I guess you could do an MUE. Like, what are you doing even at a bigger level, or what are the career paths, and what kind of work would that be, and who would you be working for?
Yeah, so there's two or three things I could go down different pathways for that. First of all, even at an institutional level, we try and share data with other institutions, and Vizient is one of it used to be called University Health Systems Consortium, but Vizient is a collaborative of a number of different academic medical centers, and they pull data from multiple different institutions into one data set, and we can oftentimes use that for benchmarking against other institutions. Secondly, there's oftentimes that we develop research collaborations with other organizations. And so then it becomes a data sharing concept where we have to pull data from our system and anonymize it, of course, and go through IRBs, but we can combine it with that from other institutions and then look across institutions for research questions that we might have either clinically, financially, performance improvement wise, all kinds of different options there. Also, I think if you go into any pharmaceutical company, they are collecting data all the time, and analytics and informatics are huge in those environments. So if you think about it, you can use it at a hospital level. You can use it at a retail pharmacy level. You can use it at a research institution level. If you want to do research with it, you can use it at a pharmaceutical company level. You could use it at PBMs, Blue Cross Blue Shield. All those different organizations really do a lot with analytics.
Keep sending me questions, audience, if you got anything you want to be talking about here. So you talk about all these different levels that could be retail pharmacy. You can imagine how much data Walgreens has got, not to mention what's the federal government got. It's just amazing how big this can get. What are your thoughts on career outlook for this, for those, our current students?
Yeah, I think there's a great opportunity for students to get involved in this type of activity. People don't realize the value that pharmacists can provide by having the blend of clinical knowledge and the informatics and analytics knowledge. And so if you develop that skill set, I think the demand for your services just skyrocket. And the nice thing about it is, physicians typically don't have a lot of time to spend doing a lot of these analytics. Nurses don't have a lot of time to spend doing these analytics. And so if you can get into an institution that sees the value that you can provide, I think that opportunity is really, really, really great. We keep churning out residents from informatics residencies, and they don't just do analytics. Sometimes they do electronic medical record configuration work and other aspects. So if you're more into those types of things, those opportunities are available to you too. Epic is one of the major electronic health record systems that's out there, and there are about a dozen pharmacists at Michigan Medicine that just do configuration of that system, and they get involved in configuring the system to do clinical decision support and other things. So there's really a large breadth of opportunities, even just in the informatics and analytics world.
Tell me how you feel about your job and what you do and what your team does as it relates to patient care. I mean, for example, I always felt like I had a bigger influence on patients through my research, that it could be spread out to more people than I could on the patient that I was running on that day. I might be able to see a dozen patients in a day, but my research could impact more. And what are your thoughts along those lines?
Oh, I agree that there's a breadth of opportunities that you have to directly impact patient care. Analytics also involves looking at the workload that you might have in a pharmacy department, and helping the department realize that you're short staffed. You don't have enough staff just to provide the quality level of care that you need. And so you can help by ensuring that the department's properly staffed. You can help out by looking at some of the safety triggers that might be out there, things that people have been prescribing in a manner that's not appropriate. And so that's another opportunity for it to be done in an aggregate manner. performance improvement for the department to try and improve turnaround time, to try and identify doses that are being prescribed that are too high. Those are global kind of medication use evaluation level activities that you can do with analytics that you can then turn right around and implement an intervention that's going to prevent that from happening in the future.
So you've used the term, and you said you've got people who work for you who are analytics pharmacists, which I guarantee wasn't a term that existed when I went to school or you went to school. So what is a day in the life of an analytics pharmacist?
Yeah, so be a really good question to ask Carl, my analytics pharmacist. But he is really deep into the infrastructure for data that we have, and so every day there are automated functions that he has set up. They're called stored procedures that run in the background. And if something fails, the first thing he needs to do every day is to figure out why it failed and make sure it runs. After that happens, he then turns his attention to any of a number of projects that we have on the list. Last time I looked, we had 43 projects for this particular year, of which we're not going to get to probably at least 2/3 of those. But he'll turn his attention to those projects, and that could involve trying to work with clinical pharmacists to understand the workflow and figure out how we're going to do analytics around the data, because we need to understand that workflow. It could be just coming up with a project management scheme for a new project that we might put into place. And a lot of it is actually running queries, which SQL is a Microsoft standard. And the query that uses a term called SQL, which is structured query language, which is just basically a computer request that you make of the system to bring back data to you. And once you bring that data back, you have to validate it, make sure it's been put together correctly, that there aren't any flaws in the data, and then merge it with other pieces of data to try and show whatever solution that you're seeking to do for any problem that you might have. So day in the life is really roll up your sleeves, get into the data, work with your computer, and run a series of queries to try and understand what's going on, and look at the output to see if it's showing the data that you need it to.
I don't want to just only talk about the analytics, but I find it fascinating because it didn't exist. But you're also in charge of safety, and what is the role of the pharmacist in safety? We have safety officers now, which is another thing that didn't exist. And talk about that career path, or is it any different? Maybe it's very similar to sort of this analytics path that we talked about for those students who are interested in that.
Yeah, so one of the things that's interesting about the area that I have, which is pharmacy analytics, quality, regulatory, and safety, and I call it PQRS to make it nice and easy for me to remember, is that we all do a little bit of everything in that. So the safety people spend a lot of time in data, and one of the main roles of a medication safety officer is to do a root cause analysis when a problem's been identified, to try and identify solutions that might prevent that from happening in the future. More and more, we want to move into the data realm with our medication safety officers, so that we do more failure mode and effects of analysis type preventative work to ensure that we don't have problems before we implement a system. We're doing that right now with trying to put dose prep in, which is a checking system to make sure that people are dispensing the correct product. And so they get involved in the data end of it as well. And the third thing that they do in that world is educate. They educate nurses, pharmacists, technicians, et cetera, on proper ways of doing their work, so that we don't cut corners, we don't make mistakes, there aren't errors of omission and commission that occur. So it's a complicated job.
One of the things I've always admired about you is that you haven't actually been a College of Pharmacy employee for a long time, but you've been really involved in the college really your whole career. But the thing that I admire the most, I think, is you publish a lot. I see your name in journals all the time. It's not necessarily your job. You're not in the publisher parish job, but you do that. Why do you do that?
Well, I love academia. That is really why I enjoyed pharmacy so much over the course of my career. I love teaching students. I love other people learning from experiences that we have at Michigan that I think are unique, that are new, that are innovative, that people can build upon at their own organizations and institutions. Most recently, we had, we had put into effect a compounding compliance team, which is a brand new concept to try and improve the safety around compounded products. And I just had this idea a few years ago that we should publish on that. And we put together 5 publications that came out of that group. I thought up what the topic should be. I worked with the people that I'd worked with over time and said, these are the people that should be the authors. And we went ahead and published that series of 5 articles, which is kind of unprecedented.
And yeah, I mean, so by doing that, I guess you've had your name you're sort of famous nationally, and you're famous outside Washtenaw County as well as inside Washtenaw County. But you do a lot of national leadership. Can you talk about sort of that path, how you got involved? Would you recommend it to others, that sort of thing?
Yeah, absolutely. One of the things that I think is really important is to connect with others and to do networking outside of your own little space. It's very easy to just look at your job as something you need to do between 8:30 and 5 or whatever the time may be. But when you start connecting with people outside of your own sphere, you learn. And that to me is the most important thing about my career and the jobs that I've had is I'm continuously trying to learn. And so one of the ways of doing that was to work with ASHP. I've worked with ASHP. I've worked with APHA. I've done some work with the Michigan Pharmacists Association on various committees. And every time I do that, I learn something new. I meet new people that have knowledge that I don't have. And sometimes it's paid off because I've been able to find people that I want to hire or that know people that I want to hire, or maybe people that want to come offer me a job, although I haven't really left the university. But I think it's great because those national connections are critical for trying to get collaborative work done across the country and get some things out there in the literature that really has been missing, and everybody's feeling the same pain.
I got to ask you, what are the biggest challenges that you face in your job on a daily basis?
Gosh, everybody's going to say time, and so I'm going to say time is one of those particular activities. But there's a lot of red tape at a big, large academic institution like we have, and so what do I do? Is I don't settle for no. If I think something's important, I keep going at it and at it and at it from every different angle that I can think of. I knew we needed an analytics pharmacist for many, many years, and we just didn't have approval for a position. So I came at it from 3 or 4 or 5 different directions.
And how do you make a case?
How
do you make a case for that? So you know in your heart you need that. It's what's neat about you is you've been an administrator and you've got these other roles. So this is kind of like in the old days when we wanted to get a new clinical service started. You did this. How do you make such a case? And what's the end zone, the touchdown? How do you get there?
That's a great question. So it depends on who you're reporting to, but I've done it multiple different ways. I've done the work myself to prove that there's opportunity. I've done preliminary work to show that there's a major problem. I've gone into situations before and said, I'll tell you what, you come back in a year. If I haven't proven the value of this position, take it away from me. So there's a lot of different ways that I will go after these positions. And it's not just because I want to try and build a kingdom. They're needed. And we have a unique skill set that can solve problems that have been existent for a long time. And so it's just multiple different pathways. It's knowing the right people to talk to. Sometimes I've gotten letters of endorsement from different clinical department chairs from the organization itself to say, hey, we've seen this in action, and we know it's going to provide value to us. We think you should fund it with a position. So multiple different pathways.
All right. Well, we're coming to the end of time. If there's any last questions you want to squeeze in, audience, kind of quick type them in. In the meantime, I'll ask you, what what advice would you give to our current students or potential students if they're really interested in a career along these lines?
Yeah, so keep your mind open and always explore new things. Dig in with both feet. I mean, I've built my own computers at home. It's all self-taught. Everything's self-taught. I don't have any informatics or analytics training, formal analytics training. I've done it all myself just by digging in. So if there's a need and there's an opportunity, dig in. And with everything available now on the internet and the World Wide Web, it's much easier than it was when I first started.
You're getting more questions coming in. And one of the things that I've learned just talking to you now is there's a lot of, it's not just informatics, like there's sub areas of informatics now. It seems like there's different niches that you could be involved in. You know, how does a student get the experience to figure out what sub area might be the best fit for them? Or if you go down one path, are you stuck? Can you never go to a different one? Can you talk about that just a bit?
Yeah, well, if you look at my pathway, I've gone down every
You've been on
possible
every
pathway
path.
you can
That's
think
right.
of. But I would say that, you know, informatics residency is a great opportunity for that, and pick the right one. At Michigan, you know, for example, at Michigan, we offer an academic rotation. We offer a private business rotation. We offer work with the EHR. We offer analytics. We offer administration. We offer business aspects of analytics, and you can learn what you like that way. And sometimes you just need to go to a place with an interest in informatics or analytics and just start doing it in addition to your current job. And then once you start showing value, people will gravitate to you and say, well, you know, I see you need more time to do this type of work. Why don't we make your position a half-time position analytics and half-time clinical? And the next thing you know, you're full-time analytics or full-time informatics or whatever the case may be.
Wonderful. Well, thank you for meeting with us. I've learned a lot about all of this kind of area, which was never my thing, and I never built my own computer either, I have to say. And I want to thank you for all that you do for our students and all you've done for the College of Pharmacy over your career. I would like to in, ask you, I guess, if you'd be interested, if people have follow-up questions. We've listed your non-UMich email here, which gives you a fantastic unique name, mgobruski@gmail.com. So questions can be forwarded to Dr. Chaffee there. And for the audience, tune in next week for our seminar with Jim Stevenson, who's was at U of M for lots of years, is now trying some new things, and we'll explore his views on working in hospital health system pharmacy, and working in some of the technology companies, and he's got a really interesting background I think you're going to enjoy. Thank you very much again, Dr. Chaffee, and good night, audience.
Yep, thank you for inviting me.